Pause for a moment and ask yourself something honestly. When was the last time you woke up and your body felt completely pain-free? No tightness, no stiffness, no discomfort at all. Can you even remember a morning like that? When was the last time you got out of a chair and didn't feel that familiar pull in your lower back, or that deep, stubborn stiffness in your knees that makes those first few steps feel heavier than they should? Does your morning start like you're stepping carefully, almost as if the ground is harder than it used to be? If you're quietly agreeing right now, there's something you need to hear clearly. You are not damaged, you are not too old, and you are definitely not the only one going through this. Most people assume that once the body starts stiffening and joint pain becomes part of daily life, it's just a normal, unavoidable part of aging, something you simply have to accept. But that idea is misleading, and today we're going to challenge it. Many believe the only solutions are painkillers, heating pads, or just learning to tolerate the discomfort. But what almost nobody explains is this: the real issue is rarely age itself. More often, it comes down to how little the body moves in the right way, especially the gentle restorative movements that most people are never taught as they get older. You might think you're too stiff or too tired to exercise, but that's exactly where the misunderstanding begins. If you can sit in a chair comfortably, you already have everything you need to begin reducing that stiffness. You don't need intense workouts or complicated routines. You need safe, simple movement that works with your body instead of against it. Before you even get out of bed tomorrow, imagine being able to ease that morning tightness without pain or strain. These gentle chair-based movements are designed to help release tension, improve circulation, and reduce that heavy, locked-up feeling in your back and joints, all without stressing your body. At the Weird Lab, we focus on what actually supports your body in real life, not extreme routines or unrealistic expectations. Today, we're going to explore gentle chair yoga and light stretching, simple practices that are quietly transforming how many people experience their mornings. By the end of this, you'll understand why your body has been feeling this way, and you'll also have a safe, practical set of movements that older adults can do at home without any special equipment. When these gentle techniques are combined correctly, something interesting starts to happen. The body begins to loosen, movement feels easier, and that constant sense of stiffness slowly starts to ease. There's no need for a gym, no need to get down on the floor, no fear of falling or overexertion, just a chair, your breath, and a few intentional movements that work with your body's natural ability to recover. To understand why this works, think of your body like an old car engine that's been left in a cold garage overnight. When an engine is cold, everything inside it thickens. The oil doesn't flow smoothly. The parts don't glide the way they should. Instead, everything feels tight, resistant, and slow to respond. Your body works in a very similar way. When you stay still for long periods, especially during sleep, your joints, muscles, and connective tissues become less flexible. Blood flow slows down. Everything feels stiff and uncooperative at first, but just like that engine, once you gently get things moving again, everything starts to loosen up and function more smoothly. What you're describing is exactly what many people feel when stiffness shows up first thing in the morning. During sleep, circulation naturally slows down. The fluid inside your joints, called synovial fluid, can become thicker and less mobile. This fluid normally acts like a lubricant between your bones, helping everything glide smoothly. When it doesn't flow well, that familiar morning stiffness, grinding sensation, and slow start feeling can appear until your body warms up again. There's also a deeper layer to this. Inside your cells, there are regulatory systems that control inflammation, repair, and stress response. One of these pathways is often discussed in science as NRF2. When your body is regularly moving and recovering well, these internal systems stay more balanced and efficient. But long periods of stillness, especially sitting for hours or avoiding movement because of discomfort, can contribute to more inflammation and reduced cellular efficiency over time. Another important piece of the puzzle is your mitochondria, the tiny structures in your cells responsible for producing energy. As we age, mitochondrial efficiency can naturally decline, which is one reason energy levels and tissue recovery can feel slower after 60. Gentle movement helps support circulation and oxygen delivery, which gives these tissues a better environment to function and recover. The key point here is simple. Your body doesn't need extreme exercise to respond positively. It responds best to consistent, gentle movement that improves blood flow and keeps joints from staying locked in one position for too long. Many people make the mistake of jumping straight into intense stretching routines they see online. The problem is that if your joints and muscles are already inflamed or stiff, aggressive or deep stretches can irritate the tissues further. Instead of relief, it often leads to more discomfort and discouragement. That's why seated, controlled movements are so effective for many older adults. They reduce risk, respect joint sensitivity, and still encourage circulation and mobility. Over time, this type of gentle work helps the fascia, the connective tissue that surrounds your muscles, become more hydrated and flexible. When fascia is tight, it can feel like everything is stuck. When it loosens, movement feels smoother and less restricted. A helpful way to think about it is a garden hose. If it's twisted or kinked, water flow is blocked. Your tight muscles and fascia behave in a similar way. Gentle movement helps uncurl those restrictions so blood flow and mobility can return more naturally. Now let's move into the practical part of the routine. Start by sitting near the edge of a stable chair with your feet flat on the floor, about hip width apart. Let your shoulders relax and gently lengthen your spine upward, as if the top of your head is being lifted slightly. Take a slow breath in through your nose, then exhale slowly through your mouth. Repeat this 3 times. This helps calm the nervous system and prepares your body for movement. Next is a simple neck release. Slowly tilt your right ear toward your right shoulder. Don't force the stretch. Just let the weight of your head create a gentle opening along the opposite side of your neck. Hold it there and breathe slowly for a few breaths. Then return to center and repeat on the other side. This helps reduce tension that often builds up in the neck and upper back and can contribute to headaches or stiffness. Now move into a seated spinal flow. As you inhale, gently arch your back, open your chest, and lift your chin slightly. As you exhale, round your spine, tuck your chin, and draw your belly in gently. Continue moving between these 2 positions in a slow, controlled rhythm for about a minute. This helps improve spinal mobility and encourages better communication between your body and nervous system, which plays a role in how pain is perceived. From here, add a seated side stretch. Raise one arm overhead and gently lean to the opposite side. Keep the movement soft and controlled, feeling the stretch along your side body. Breathe into the expanded space rather than forcing depth. This helps release tension along the ribs, spine, and hips. Then, for hip tightness and lower body discomfort, a simple seated hip-focused movement can help reduce pressure around the lower back and glutes, especially in the area where the piriformis muscle can sometimes irritate the sciatic nerve. Gentle, repeated movement in this area helps reduce tightness and improve comfort when sitting or standing. Overall, the idea is not intensity. It's consistency, control, and safety. When these gentle movements are done regularly, the body gradually shifts out of that stiff and resistant feeling and into smoother, more comfortable motion over time. The seated figure 4 stretch is one of the most effective ways to relieve that deep, trapped tension in the lower body. Start by crossing your right ankle over your left knee. From there, gently press your right knee downward without forcing it. Keep your spine long as you slowly hinge forward from your hips. Avoid rounding your back. You should feel a deep, steady stretch through the glutes and outer hip. Before continuing, a quick but important reminder. If you experience sharp pain, tingling, or numbness, stop immediately and seek advice from a healthcare professional. Mild discomfort or stretching is normal, but sharp or radiating pain is your body's warning signal. Safety always comes first. Now bring attention to your lower legs. Lift your right foot slightly off the floor and begin slow ankle circles. Make large, controlled rotations about 5 times in each direction, then switch to the other foot. This simple movement improves circulation and helps reduce that heavy, stiff feeling in the legs. Your calf muscles act like a secondary pump for blood flow, and when you move your ankles regularly, you support that natural circulation system, helping reduce swelling and fatigue. Next, move into seated knee extensions. Sit upright and slowly extend your right leg straight out in front of you. Hold briefly, then lower it back down with control. Repeat about 10 times on each leg. This helps strengthen the quadriceps, which are essential for standing up, walking, and maintaining balance. Weak thigh muscles are one of the major reasons people struggle with stability as they age, so this simple exercise plays a big role in fall prevention and daily independence. For lower back relief, focus on the hip flexors. When you sit for long periods, these muscles often become tight and shortened, which can pull on your pelvis and increase pressure in the lower back. To address this, sit near the edge of your chair, slide your right foot slightly back, and gently tilt your pelvis forward. Hold this position for several slow breaths before switching sides. Practicing this daily can significantly reduce lower back tightness over time. Now, move into a seated thoracic extension to open up the upper back. Interlace your fingers behind your head, gently lift your chest, and lean slightly backward over the chair. You should feel a controlled opening through the upper spine and shoulders, helping to counteract the forward hunch that builds from daily sitting. At this point, take a moment to reflect. How long has this discomfort been part of your life? Weeks, months, or even years? Share your experience if you want to track your progress. Every story matters in understanding how widespread this issue really is. Next comes a seated spinal twist. As you inhale, lengthen your spine upward. As you exhale, slowly rotate your torso from the waist, not just the shoulders. This gentle twisting motion helps mobilize the spine and encourages fluid exchange within the spinal discs. Think of it as a gentle reset that helps bring fresh hydration into the discs while easing stiffness and tension. Now shift focus to your hands and wrists. Open your fingers wide, hold for a few seconds, then slowly close into a soft fist. Repeat this opening and closing motion about 10 times. These small movements help maintain grip strength and hand mobility, both of which are essential for daily independence and simple tasks like holding, lifting, and carrying. To finish, bring everything together with slow, intentional breathing. Place one hand on your chest and the other on your abdomen. Inhale for a count of 4, hold briefly for 2, and exhale slowly for 6. This breathing pattern helps activate the parasympathetic nervous system, calming the body and reducing stress hormones that contribute to inflammation and discomfort. These movements are not meant as a quick fix, but as a consistent daily practice. Even 10 minutes each morning can gradually improve mobility, reduce stiffness, and help the body feel more open and capable again. The key is repetition and patience. Your body responds to consistent signals of safe movement. Better sleep also plays a major role in recovery. When you rest well, your body has the chance to repair tissues and maintain joint health more effectively. Over time, you may notice mornings feel less heavy and movement becomes easier and more natural. This is not the end of your physical story. It's the beginning of a new approach, one where you regain comfort, confidence, and ease in your daily movement. You are not broken. You simply needed the right kind of support and guidance. If you want more evidence-based health insights, subscribe and stay connected. We share practical guidance each week to help you age with strength, stability, and confidence. Everything in this video is for educational purposes only and is not intended to replace professional medical advice. Always consult a qualified healthcare provider for any medical concerns.